If you struggle with anxiety and are wondering whether EMDR therapy can help, this video is for you. Today, I'm going to go over what is anxiety and common symptoms, how trauma can result in anxiety, quickly go over what EMDR therapy is, and tell you in what cases EMDR therapy can be an effective treatment for anxiety. And finally, I'm going to give you some reasons why you may want to choose EMDR therapy to help you with anxiety. Hi there, my name is Ashley Phillips, and I'm the founder of the Kelowna EMDR Clinic. My team and I regularly use EMDR therapy to help people deal with and ultimately overcome their anxiety. It's actually one of the more common reasons that people come to see us. So let's begin. Anxiety is a response to stress, and it's an emotion characterized by worry, dread, fear, and uneasiness. It feels similar to fear, but there's key differences. Anxiety is considered a future-oriented, long-acting response, broadly focused on like a low-level threat, whereas fear is an appropriate, present-oriented, short-lived response to a clear and specific threat. Physical symptoms of anxiety can include like an increased heart rate and a shortness of breath, muscle tension and a dry mouth, an inability to stay calm, these cold, clammy hands, trouble sleeping, fixating on a problem, and we just can't concentrate. I do want to say that anxiety is a perfectly normal and a useful state. And it would be impossible to find someone who has never experienced anxiety at any point in their life. But when anxiety becomes a regular experience that interferes with your daily life, it can be known as an anxiety disorder. There is no lab test to conclusively diagnose an anxiety disorder, but a therapist, psychologist, or a psychiatrist can make a determination based on their understanding of your history, the current situation, and answers to relevant questions. There are a number of reasons why a person can develop an anxiety disorder. One of the reasons can be a trauma response. So let's see how people struggle with anxiety as a protective response against something that has happened to them. So let's consider these fictional examples. First, we have Carla. She took part in a school play and she forgot her lines during the performance in front of the entire audience that included her schoolmates, her parents, teachers, and the wider community. And as a result, even the idea of speaking in front of people fills Carla with anxiety. This has affected her career as she doesn't want to apply for any positions higher up in the company that would require her to make presentations and speak in front of her peers. Then there's Dave. He was in middle school when his parents moved the family across the country. He had a really hard time adjusting to the new city and he experienced difficulty making friends at the new school. It's now many years later and Dave's spouse was offered an amazing work opportunity in a different city. And Dave understands and he knows that this is a positive development, but he feels paralyzing anxiety about the idea of moving. Finally, we have Mary, and she unexpectedly lost her job with the unfortunate timing of this happening shortly after she purchased her condo. She was late a couple times on the mortgage payments, and she was constantly worried about her ability to pay the bills and the possibility of losing her home. It took her 2 months to land the next job, and ever since then, she finds herself anxious about the economy, the financial health of her company, and her ability to stay employed. In each of the cases I just mentioned, the anxiety is related to public speaking, relocation, and job security, and it has a direct link to the traumatic event in this person's life. Now, if you're watching this and you struggle with anxiety, what have you found helpful at managing it? Let me know by leaving a comment below. Since this video is about EMDR therapy as treatment for anxiety, let's quickly go over what this therapy is. EMDR stands for eye movement desensitization and reprocessing, and it's a type of psychotherapy that is widely used in different clinical settings to help people heal from trauma and distressing life experiences. It was developed by psychologist Francine Shapiro in 1980s and has since been extensively researched and proven effective for treating various conditions linked to trauma. Much like the body heals from physical wounds, the brain often heals on its own from psychological wounds caused by trauma. But sometimes the mind gets stuck on traumatic experiences and it just never really heals. And this stuck trauma will manifest itself in various symptoms, and anxiety is a common one. EMDR therapy works by encouraging the brain to process traumatic memories in a way that will reduce its emotional intensity. During an EMDR session, clients will focus briefly on a distressing memory while simultaneously engaging in bilateral stimulation. And this is usually through guided eye movements. And this combination is thought to help the brain unlock the stuck processing and allow the natural healing to resume. On this channel, I talk a lot about trauma, EMDR therapy, and private practice. I previously made a video on EMDR therapy as well as a series of videos talking about in detail about all of the 8 phases of EMDR. I'll link them in the description, so make sure to check them out. We talked about how anxiety can be caused by past trauma and how EMDR therapy is an effective trauma treatment. So as long as your anxiety is rooted in an unresolved traumatic experience, EMDR therapy can be a very effective treatment for anxiety. In fact, anxiety is one of the most frequent reasons why people reach out to us here at the Kelowna EMDR Clinic. The cool thing about EMDR, and the reason why I love it as a therapeutic modality, is that rather than treating the symptoms, EMDR therapy treats the root cause. So instead of just helping people manage their anxiety, EMDR therapy can help get rid of that anxiety for good. As I mentioned earlier in the video, EMDR therapy works by getting the traumatic event unstuck so that your brain can process it and resolve past trauma. As a result, your anxiety that was caused by the traumatic experience kind of just melts away. This happens because the underlying trauma doesn't have the same effect on you as it did before the therapy. Now, what I do want to say is that if your anxiety is not related to past trauma, EMDR therapy may not be effective. The best way to find out is to talk to a therapist or a mental health professional about your specific situation. Finally, I'd like to give you 5 reasons why I think EMDR therapy is one of the best treatments for trauma-related anxiety. Reason number 1 is that EMDR therapy is a prescription drug-free approach. Some people really don't want to use prescription medications to help with their anxiety for various reasons, and EMDR therapy is a really great tool that can help reduce their symptoms. Medication absolutely can be a very helpful tool to get your anxiety symptoms under control, but it most likely will not resolve the issues that cause your anxiety, especially if it's trauma related. Okay? Reason number 2, EMDR therapy can treat anxiety faster than other talk therapies. We have had people that have struggled many years with anxiety and they've gone to therapy without, big results, and they showed noticeably big improvements after just a few sessions. EMDR therapy can save you time and money. Reason number 3 is that it does not require you to recall and relive the traumatic event that is a source of your anxiety in painstaking detail. Reason number 4, EMDR therapy doesn't have extensive homework associated with it. I generally ask my clients to practice the emotional regulation strategies and to log their symptoms, but that's about it. And finally, reason number 5 is that EMDR therapy goes after the root of the problem as opposed to the symptoms. Many therapies are going to teach you strategies for dealing with anxiety, whereas EMDR therapy, on the other hand, targets the cause of the anxiety. And when the cause is no longer present, the anxiety symptoms will go down with it. I hope you found this video useful. Since you've made it this far, why don't you give this video a thumbs up and a like, because you will help others find this information. And if you haven't done so already, make sure to subscribe to my channel so you don't miss any future videos on trauma and EMDR therapy. See you next time.